We're going to start off with a panel, two panelists giving an overview of issues having to do with cost-benefit, or benefit-cost. I can see this is going to be a theme. Margaret Kuklinski is a research scientist at the Social Development Research Group, School of Social Work, University of Washington. She's interested in the design and analysis of programs to promote positive youth development, and is currently working on the Community Youth Development Study, which is an example that she'll use to illustrate some of her points. So why don't you get us started? Thank you.
All right. First of all, thank you for having me here today to present the need for standards, lessons from benefit cost analysis of communities that care. As Dr. Curry mentioned, I'm a research scientist at the Social Development Research Group. We're part of the School of Social Work at the University of Washington, and our tagline is improving lives through research. I think we need to add to this tagline and intervention, because a large part of what we do has to do with developing, implementing, and testing preventive interventions for youth. We hope that our interventions will improve youth development, and they do this by reducing risk factors, things like family management problems or family conflict, early drug use by kids. And they also increase protective factors, things like family communication skills and kids' refusal skills against taking drugs. These risk and protective factors operate in the various contexts in which kids develop, communities, schools, homes, and in kids themselves as well. In recent years, we wanted to understand not only whether our interventions are effective, but also what are the economic implications of the improved youth outcomes that our interventions achieve. And that's the work that I do at SDRG. In the course of doing this work, and in particular in doing our benefit cost analysis of communities that care, many questions have come up. Many analytical decisions have had to be made, and the field has not been clear about best practices. So that's why I'm here today talking about the need for standards, because those different decisions that one can make have implications for the bottom line. I want to take a step back for a moment in this overview presentation and talk about how far the field has come in the past couple of decades. So I think there are some key reasons for the growing interest in benefit cost analysis and prevention. First, of the three major economic analysis strategies, cost effectiveness, cost utilization, and benefit cost, only benefit cost analysis can sum up in dollar terms across the multiple outcomes that prevention tends to affect. So that makes it an attractive tool. It's also the case that in this age of tight budgets and increasing need for accountability, policymakers and others want to know not only what works, but what interventions are also cost beneficial. And so there's a growing interest in benefit cost analysis and prevention. But as the number of studies and applications has increased over about the past 2 decades, I think there's also an increased need for standards, and I want to illustrate that in 3 ways on this slide. So first, there's an increasing range of topics and program areas that are the subject of benefit cost analysis. From the peri-preschool program, an analysis first done in the 1980s that continues to be influential, having just published its 40-year follow-up, to substance use prevention applications, intensive foster care, crime prevention, and many other areas that I can fit on this slide. I think this growing range of application areas raises the question of whether we can really compare findings across studies, or are they based on methodologies that hinder those efforts. It's also the case that there's a wealth of possible information to communicate around benefit cost analysis results. For me, that raises the question of what are the best reporting practices? What do we need to know as a matter of course to have confidence in what we're reading? Finally, there's a growing use of benefit cost analysis in policy, from the work being done by Steve Ost and colleagues at the Washington State Institute for Public Policy, to Pew MacArthur's Results First initiative, hoping to increase the use of benefit cost analysis in evidence-based policymaking by states, And also in my own state, recently passed legislation that requires that programs in juvenile justice, mental health, and child welfare show evidence of being cost beneficial in order to receive the strongest support and also funding. I think when these results are used to influence policy and funding and program uptake, it becomes particularly important that we think about standards in order to ensure that those comparisons across programs are meaningful and made on a level playing field, on an apples-to-apples basis, if you will. So there's been growth in the field, but in the rest of this presentation, I want to use our work on the benefit cost analysis of communities that care to make the case for standards. Where are standards needed? I think they're needed in a number of areas, in a number of ways, from research design quality to assessing costs to estimating benefits, in other words, in all of the major components of a benefit cost analysis. In our work on communities that care, we were fortunate to be able to test this in a well-designed randomized controlled trial, so the gold standard in the field. So today, given the time constraints that we have, I'm not going to talk about research design quality standards, but leave it to others over the course of the 2 days we have here. I do want to bring up two aspects of assessing costs where I think standards would be beneficial. Those have to do with how we estimate costs in a complex multi-site trial where costs vary. And I think that has implications for disseminating our preventive interventions at scale. I also want to talk about challenges of valuing non-budgetary resources used in an intervention. In our case, that's teachers, volunteers, and board members. We need to understand the opportunity costs of these resources, even when they don't affect budgets. On the benefit side, I want to talk about implications of assessing significant intervention effects versus all effects, and also projecting benefits at different discount rates. There are many other issues to consider, far more than I can in the time frame we have. But I'm sure that these areas and many others will be raised in detail by our panelists over the next couple of days. So let me share with you what we found in our CTC test. So communities that care is a preventive intervention. It's a prevention system that takes a public health approach to promoting positive youth development and reducing problem behavior at an epidemiological level or community-wide. We found when we tested it that it reduced substance use initiation and delinquency initiation at least through grade 12. We got to those conclusions through a randomized control trial conducted in 24 communities across 7 states with good geographical distribution. Our communities were matched in pairs within state and then randomized to condition. We also had from these communities a longitudinal panel of over 4,000 kids that we followed annually over 10 years. And our communities and our kids were well matched. There were no significant differences at baseline on important socio-demographic characteristics. So far, we followed kids approximately annually through age 19 from grade 5, and right now we're still getting reports from over 90% of the youth that we started out with. Grade 12 is the last year for which we've analyzed data, and we found that youth exposed to CTC reported lower rates of initiation community-wide to a significant degree with respect to delinquency, alcohol use, and cigarette smoking. We also found non-significant results, but in the expected direction, for high school graduation and marijuana use and other drug use initiation. We knew that these improved outcomes in our CTC kids had long-term economic benefit, but it also cost something to achieve them. So we conducted a benefit cost analysis to estimate CTC's long-term economic value, and that's where a lot of questions came up. So a number of different investments were made to achieve those outcomes. First, I want to say that coalitions of diverse stakeholders, mayors, police chiefs, teachers, parents, own and operate, actually carry out prevention efforts in our CTC communities after they're trained. One of their first tasks is to survey youth at an epidemiological level to understand where risk factors are elevated and where protective factors are depressed, again, in youth community-wide. The coalition then targets the most widespread elevated risks for intervention and selects and implements appropriate evidence-based prevention programs to address those priorities. The coalition's work is not done at that point because it's up to the coalition to monitor fidelity of implementation, assess efficacy, and also make course corrections when needed to achieve the community's overall prevention goals. Overseeing the whole thing is a coordinator because, as you can imagine, there are a lot of different pieces in play, from coalition activities to surveying to implementing interventions. So a coordinator is critical in each community. We found over 5 years, $745,000 in all was invested in 3 major areas that you see on this slide. But for purposes of conducting a benefit cost analysis, we needed to understand how those investments were made on a per youth basis. And so that's what I have on this slide. These are the costs per youth across the 12 communities in our study. The largest is number 1 and the smallest is number 12. And so you can see that there are significant economies of scale in implementing CTC in the communities in our sample. One way to think about why this occurs is that coordinator. We needed 1 in each community. In our largest community, those costs were spread across many fewer youth. This raises questions for how to come up with a single cost per youth estimate. We chose, and we considered actually early on, a simple average cost and then a median cost, which helps account for some of the skew in our cost distribution. And in our early work, we chose to go with that simple average figure because it was really conservative, and we knew that any cost-beneficial results we came up with would have really strong legs to stand on the cost side. In our later work, however, we come to think that this simple average cost really doesn't reflect too well the cost in most of our communities. So instead, we've opted for a weighted average that we think better reflects the cost not only in our communities, but in communities that are likely to implement CTC. But we've also wanted to account for the substantial variability that you see on that chart. So we've used in Monte Carlo analysis a range of 35% around that point estimate in our benefit cost analysis. Although we are now quite confident with that weighted average figure, in earlier work that we published, reviewers were quite comfortable with that simple average cost as well. And as you can imagine, the choice there has implications for the bottom line, and it would be helpful to have standards. I want to turn to the fact that for CTC to be successful, we relied on an awful lot of people giving their time. Board members gave their time, volunteers in our after-school programs and other areas gave their time. And teachers also implemented some of our interventions in their classrooms, but their time was already budgeted in district budgets. How would we value this time in our analysis? In my read of the literature, there were 3 different approaches, 3 ways of thinking about this issue that I found, and I want to share them with you in order of increasing opportunity cost. So the first option that I found in the literature is that the time cost for these people is fully offset by the benefits that they and others receive or that students receive as a result of the intervention. And so in this case, the opportunity cost would be 0. The second option said that no, the time cost should be valued at the appropriate wage plus fringe rate for that position. The third option goes even a little bit higher, and it suggests that actually when volunteers give their time, they're trading off time that they could be spending in the workforce. So instead, we should be valuing time at those volunteers' actual rate, wage plus fringe, in the labor force, in their jobs. In our analysis, we didn't find a clear direction to go here, but in our analysis, given our volunteers and what they were doing, we found options 1 and 2 most compelling. That meant our opportunity costs could range from zero to as high as an additional $89 per youth on top of our weighted average cost estimate. So again, it would be helpful to have guidance to know where to land in valuing the opportunity costs of non-budgetary resources used. I want to turn here to the benefits side, and the questions that I want to share with you here had to do with, should we monetize significant intervention effects only, or should we consider all effects? And what discount rate should we use in bringing those benefits projections back to the present? As a reminder, through grade 12, CTC youth reported lower rates of initiation of delinquency and substance use and more graduated high school, but not all of those effects were significant, just the ones to the left of the line. If we focus our benefits estimates only on those significant effects and we use a discount rate of 3.5%, we find a net present benefit of $4,477 per youth. At a 7% discount rate, the value is nearly halved. And that rate, although it may seem high, is considered in the literature that I've looked at. If instead we think that we should consider all effects, regardless of whether they're significant, we come up with much higher benefits, whether they're discounted at 3.5% or 7%. Now, of course, when we include these non-significant benefits, there are much wider confidence intervals around those point estimates, and I don't have time to get into that today. But the question still remains as to which effects should be included in our analysis and at what discount rate should we use with these benefits. If we bring together the results when we just consider those few dimensions that I posed alternatives for, this is how much the bottom lines can vary. So on the low end, when we include just significant effects, do include some for opportunity costs, and at a high discount rate, our net present value is about $1,700 per youth, and our benefit cost ratio about 360. The results are much higher, of course, when we include all effects, don't have any opportunity costs, and use a lower discount rate. So you can see a wide range, and I think this speaks to the need for standards. You may wonder what we chose based on just our best thinking. We didn't have clear guidance from the field at this point. We chose to monetize significant effects only because those are the ones we had the most confidence in. We thought that there was compelling enough evidence that opportunity costs could be thought of as zero. And we used a 3.5 discount rate because although people sometimes argue for higher, a lot of studies use that 3.5% rate. And if our results are to be used in comparative analyses, it's not to our favor to use a higher discount rate. And as you can see, our results land in the middle of the range. So in summary, I think benefit cost analysis and prevention has come a long way in various ways over the past couple of decades. I think the need for standards has also grown in that time frame, particularly so that we can compare findings across studies. I also think that when our results are used to influence policy, it becomes particularly important to have standards. I tried to show in this presentation that there are different viable assumptions based on what I've seen published in the literature. And when we look at just a few of them, they have enormous implications for the bottom line. There are many other dimensions to consider that I couldn't include here. And it's important that standards be considered in those areas as well. So in conclusion, I think the challenge for the field and for a possible IOM panel is to identify areas and assumptions where there's the most common ground, and then where consensus is less clear, delineate the major alternatives. I think that this effort would be of great use to researchers like myself, to policymakers and practitioners who use this work, because it would increase methodological consistency and help us be able to make meaningful comparisons of results from different studies. Thank you.
Thanks very much. So we're going to turn to the second presentation by Charles Mikolopoulos, who's a senior economist at MDRC, studying the effect of social policies for disadvantaged groups. His most recent work focuses on health interventions, and he's the co-principal investigator on a national evaluation of home visiting programs for disadvantaged mothers, authorized by the Affordable Care Act, is leading several studies of coordinated care and care management, and was co-principal investigator on a study of the effects of health care coverage for new uninsured recipients of disability insurance.